So when you pull a tooth and you don't do anything for multiple years or maybe a few months, the bone starts to deteriorate.
It's good from here.
Well, it looks pretty good.
Yeah.
Right here, take a look. Hey guys, you know what? I got the best flooring guy in the whole Tri-Valley. Gus.
Focus.
Very nice. Gus. Well, you know, like everybody else comes to my office, they seem to always have a dental question. Now, I've got Gus here and he's got a dental question. What would that be?
I'm getting an implant.
Yes.
I don't have any bone there.
Yeah.
So what would you do if you were doing an implant?
That's a good question. You know, this is a question that everybody has anyway. When you have a dental implant, you're trying to put a tooth in a space where there is no tooth. Somebody pulled that tooth out. So when you pull a tooth and you don't do anything for multiple years or maybe a few months, the bone starts to deteriorate. Now the question that Gus has is, you know, and now since I'm a floor guy and I'm rich now, I could afford a dental implant. Because the other choice that you got is a partial denture, especially when you're missing a tooth and there's nothing to hang on a bridge. Because when you are missing a tooth, there's going to be three choices that you've got. Either a bridge, a fixed bridge that you cement, or a partial denture that you remove. And the other one when you can afford it, because dental implants are very expensive. When you can afford it, you put a dental implant. And then if you say, what's the best? An implant's the best if you could do it. But so the question that Gus has is, I haven't done anything to that back part of my tooth, so I've lost a lot of bone. I want an implant. What can I do? That's your question.
Correct.
So now, if that's the case, you're going to have to do some sort of bone grafting. Now, who does the bone grafting? Oral surgeons does bone grafting. Periodontist does bone grafting. Oral surgeons are specialists. So if you put bone on top of bone, it's not the best predictable way to do it, but can be done. So I think what your question is, I'm missing bone, it deteriorated, I want dental implant, what can I do? Especially you're talking about the lower. There's a lot of stuff there that's very important. There's a nerve in that bottom part that you got to stay away with. If you don't have any structures, a bone level that you need to put the dental implant, you need to put bone grafting. And I think that's what your question is. Your question is, I don't have bone, what can I do? I want dental implant. You need to put bone grafting.
Cadaver.
Now he's asking now what material. Totally different now. I mean, he's getting advanced in terms of the question. Because the question is, I don't have any bone, what can I do? He's asking like, where do you get the bone? A few places. You could get it from your hip, your own bone. That's the best part to do it. But who's gonna do that? Who's gonna go and say, yeah, could you get some bone over here and put it here? I'm sure they told you about that.
No. Well, the other choice would be, and of course you would know, is to take bone from
yourself.
Yeah, from your maybe another area. That another tooth is gone.
Yeah.
And then scrape the bone there, mix it with the cadaver, right? With that.
So now he's talking about, like I said, material. The best bone you can get is your own, and then your body's not going to reject your own bone. What he's talking about is an oral surgeon being able to harvest bone from another place in your jaw. He's talking about taking it in another part. He's talking about taking it in the jawbone in your mouth.
Right.
That's one place. Like I said, people take bone out of your hip because it's easy to take out. There's a lot of bone there, so you can put it on your mouth. But what he's talking about is adding your own bone to cadaver bone. Now, cadaver means that you're getting it from a dead person. Like, let's be real here. The question for you is, are you okay with that?
I'm totally fine with
Well, then, what's the question?
I'm just.
That's the question though, because some people are like, oh, you know what? I ain't doing dead person on me. Right? Well, then take it out of your own jaw and put it on the other parts, because that's your own bone that's going to be able to be put right on top of where you're missing. So now, in his case, your question is that okay? That's okay. That's going to work. It's not so much is it going to work or not, it's where they're going to put it. Because when you put bone on top of bone like this, yeah, okay, it might work. Now, the question you should have for me is, how good is that? How stable is that? Is the question.
What's your take on
The best grafting that you could do is if there's an open spot and you just cover it up, that's the best part. But if you're gonna go ahead and put bone on top of bone like this, it works, but the
Not a guarantee.
did they tell you that it was guaranteed?
No.
Well, ask them. I mean, if I was a patient, I would ask them that. I'm gonna say, Dr. Oral Surgeon, like, what's the possibility that that's not gonna work? What do you think?
That's probably the best question.
I think so, because they're like, you know what? How much am I spending on this?
Right.
And then they'll go, and the other question is, if it doesn't work, what I gotta pay again? That's the question. Like, you know what? And what I do with my friends and families and people, my neighbors, is just being practical. Practical dentistry. What's practical? Now, what you're doing is good dentistry, right? If it works. The question that you should have for your provider is, what's the percentage of this working? And if it doesn't work, what happens? That's really the question. Your question is not even, could you give me some of that cadaver bone? Because if you're okay with that. Yeah. Because some people are not okay with that, but if you're okay with that, that works.
I'm good with it.
Yes. And then the other question that people ask, really, it's going to be three things. It's either going to be, how much is it going to be? How long is it going to take? And I'm afraid to have that done.
6 months, 5 months before possibly the bone would create new bone there, meaning take to the original.
Yes, because that's the other question you've got. If you're going to do all that, is how long is this going to take? How much is it going to cost? Time and fear of what we were talking about. Dead person into my jawbone, or I don't like that procedure.
Well, it's a mix, right? It'll be a mix.
Yeah, because right now I don't think it's how much is it going to cost. I don't even think it's time because you decided, and then and you're not afraid of it, right? So a lot of it is just trying to get all information so that you're making the right decision. And then the thing that I think you should be asking is, okay, I'm willing to pay for that, but what can I expect and the chances of that happening, and what happens if it doesn't work? That's the question you should have.
Right.
And it's because I'm not even afraid. I'm willing to go there and get there because I want to eat better back there. And so really right now it's really no guarantees, but then you want to know if it doesn't work, what can I expect? Does that make sense?
Totally.
So for me, I think what you're doing is a good dentistry. And it's just a matter of trying to figure out, okay, if this doesn't work, what do I do, right? Because of a lot of people out there, and you could tell me, a lot of people out there has dental implant done, and it has to get it redone.
Yeah.
I mean, I can show you x-rays, I can show you patients of mine, and I'm going, gonna have to redo this. The question is, who's paying for that?
Mm-hmm.
Right?
Totally.
You know who's paying for that?
Me.
Yeah,
I would be paying for that.
Yeah, you better know that you're gonna have to go. Okay, like
unless you want to do it free before.
Well, not me, not with that cadaver bone stuff, because I'm telling you, practical dentistry. How successful is that? That is your question. How successful is that procedure where you put bone on top of bone like this? That's your question to your dentist. That's a question to your dentist. If you're going to get a dental implant and you're going to put bone on top of bone like this. Gus, let me know how it works out in 2 years.
I will. Thank you. Appreciate it.
Hey, make sure, my floor guy.
Floor guy right here.
Where is it, Gus?
Focus flooring right here. 6398.
Tri-Valley.
Doherty Road.